would like to conclude that palliative medicine is more of survivor careship now. And we have our patients who Google palliative medicine equivalent to terminal care, which is no more so. And we have patients with survivorship, overall survivor of more than 5 years. And the points that have been stressed now by Rekha sister and Shalaka sister will help the patients to go through this survival period. Thank you, sister. Any doubts in the previous sessions? Any questions for any of the other speakers?
Any discussion or any addition you want to do? Whatever talks we had up till now, I think we have covered various different dimensions of CA lungs, right from your emergencies to your various newer therapies like targeted therapy, immunotherapy, and also we discussed the side effects of all these therapies. It was important to discuss palliative component of this today's workshop because most of the time CA lung patients, they approach or they come to us in a very late stages where we require to support them in all the aspects like your not only the symptom management and physical symptoms, but also the psychological and social assistance is expected from nurses. So I hope from today's workshop you will take a home message on these various topics and you will try to implement all those topics. And I would like to say that today we had many topics which were very practical, like Ratna's topic was very practical, and most of the time basics also important when we deal with this patient. So I just ask Archana to conclude today's sessions.
As madam said, Ratna Prabha's topic was also very important, and when we are talking about optimization of oxygen delivery system, it is essential that whenever we get a patient who is collapsed or we know that he is having some amount of breathing difficulty, we start the patient on oxygen. But then we start the patient on 2 liters or 4 liters. So when to stop and which is the correct device to be used for this kind of oxygen therapy is very important. We would see that most of the time patients are using nebulization mask for oxygen therapy. We may think that we are saving on money by using one mask for 2 purposes. But we have learned from the presentation that it is a wrong practice, and nebulization mask is not optimizing the oxygen that we are giving. And we may conclude that the patient is not improving in spite of receiving 6 liters of oxygen per minute. Whereas if we give the same amount of oxygen using an oxygen mask, the results would be much better. Then during COVID times, we have used Venturi mask in the isolation ward as well as in other settings also. And we have seen that the FiO2 provided by the Venturi mask is much better. So we can shift to Venturi mask, which will be more beneficial to the patients. Anything else?
That one more point I want to add, that whenever patient is asked to give the nebulization, it should be given through the nebulization machine instead of the oxygen, because when you are giving nebulization with the oxygen, patient doesn't require oxygen, then also you are giving the oxygen, it will cause the oxygen toxicity. And whereas which patients required oxygen with the nebulization, then only you have to use the nebulization mask for the oxygen as well as the nebulization. Each ward nebulization machine is there. In our hospital, we are having the nebulization machine.
Pediatric wards. Pediatrics what they require basically, because their needs are different. But in our hospital, we have started with plain mask also. Earlier also it was there. In between, I think we had stopped. But now also you can get from the stores.
we would like to conclude this beautiful session with a poem. One word can spark a moment, one flower can wake the dream, one tree can start a forest, one bird can herald spring, one smile can bring a friendship, one handclasp can lift a soul, one star can guide a ship at sea, one cheer can obtain a goal. One vote can change a nation, one sunbeam can lift a room, one candle wipes out darkness, one laugh will conquer gloom. One look can change two lives, one kiss can make love bloom. One step must start each journey, one word must start each prayer. One hope can raise our spirits, one touch can show you care. One voice can speak with wisdom, one heart can know what's true, one life can make a difference, one life is me and you. So, all of us, let us strive together to be that one person who would like to bring change in our patient's life, a positive change in our patient's life. Thank you very much for being patient listeners. Yes, sir. We will be having a post test, and before the post test, I would like to give the vote of thanks. As we come to the end of this beautiful session, I take the opportunity to thank Director TMC Dr. Badwe, Director TMH Dr. Pramesh, Deputy Nursing Superintendent Sindhu Madam for giving us this opportunity to arrange this session and to attend this session. We are grateful to Dr. Kumar Prabhash, Head of Department Medical Oncology TMH, Dr. Nandini, Dr. Vijay Patil from the Medical Oncology Department for their valuable guidance and support throughout from the planning to the execution of this session. I am grateful to the Cancer Research and Statistics Foundation for arranging such a beautiful event for us, and I am also thankful to Garima and Mr. Tarun and her team for taking care of all the technicalities of this session and also bearing with us for all the last minute changes that occurred. And last but not the least, a very big thank you for the beautiful audience and patient listening. Thank you. We will have post test now. I will be forwarding it on to the group. Let us solve the post test right now.